Hi everyone, thank you so much for joining me. If you haven't already subscribed to my YouTube channel, please do so you don't miss out on any amazing videos. In our last endometriosis video, we talked about critical information that anyone struggling with endometriosis should know. So if you haven't watched that video, please go back and do so you don't miss out on that critical information. We also talked in the last video about how approximately 70%, I think it's higher, but they say about 70% of women with endo also struggle with pelvic floor dysfunction, and that's because there are so many overlapping conditions that coexist with endometriosis. Pelvic floor physical therapy should always be included in a healing plan of care for endometriosis and should be the first line in conservative treatment for endometriosis. So today we're going to talk about how exactly can a pelvic floor physical therapist help you if you do have endometriosis. There are so many ways, and today we're going to talk about just a few. So pain. So many women with endo struggle with pain, so much more so than just painful periods. They can struggle with low back pain, hip pain, groin pain, abdominal pain that sometimes lasts all month long. A lot of women with endo also complain of a pulling sensation, and that's because they have adhesions or scar tissue. Connective tissue is meant to slide and glide. So if you have an area of scar tissues, those tissues get stuck together and can cause a sensation of pulling because they can stick, the connective tissue can stick to each other, it can stick to muscles, organs, tendons. So if you think about the connective tissue or the fascial system like a sweater that covers from your head to your toe, if there's a pull in that sweater, it can cause pain even in a distant site from where there actually is adhesions. Pelvic floor physical therapists are trained to help with these painful conditions. We have great orthopedic skills. We are trained to release restrictions in the fascial system or the connective tissue system, and even to release connective tissue around the organs. Personally, I use a multimodal approach. I use a wonderful modality called micropoint stimulation, which really helps to release the scar tissue. I use that in combination with manual techniques like soft tissue mobilization, myofascial release, and visceral mobilization, and connective tissue rolling. And I find that a combination of various techniques really helps to get patients feeling more comfortable and to help those restrictions be released. Another area that clients with endo struggle with and that pelvic floor physical therapy can help tremendously is pain with intercourse. A lot of clients with endometriosis experience pain with intercourse. The pelvic organs live right on top of that pelvic floor, and if there's inflammation or restrictions anywhere in this pelvic bowl, then clients are going to experience pelvic floor dysfunction as well. Many clients protectively guard that area, and their pelvic floor muscles become overactive and tight in response to the pain. This can be a source of pain with intercourse, but then what happens is that these women have experienced pain with intercourse, and then they begin to protectively guard in anticipation of the pain, which can further make the entire experience even more uncomfortable. Physical therapists can help teach clients strategies to help keep the nervous system calm, to prevent that anticipatory guarding. We can help to physically release those pelvic floor muscles. We're trained in intravaginal and intrarectal releases, so we can access those muscles and release the restrictions and help to relax those muscles. We can teach you breathing strategies to help relax and lengthen the area. And of course, we need to teach you self-care strategies so that you can continue with that at home. Another wonderful modality that we use is biofeedback. Biofeedback is sort of like a mirror that gives you information as to what your body is doing when you're either trying to engage or relax those muscles. We use either external electrodes or an internal probe, and it actually gives the patient direct information as to what their body is doing. This can really help with that brain-body connection and reestablish the coordination of the brain and the body and teach the client how to engage or relax their muscles even more efficiently. Another option for care is electric stimulation, which can help with pain and also help to promote blood flow depending on what kind of electrical stimulation we're using. And we can also implement that either with external electrodes or with an internal probe. A huge area that pelvic floor physical therapists can help clients with endo is with bowel and bladder dysfunction. In order to urinate and defecate efficiently and optimally, the pelvic floor muscles need to be completely relaxed. A lot of clients with endo have that protective guarding of their pelvic floor muscles and can have symptoms of urinary urgency, frequency, hesitation, pain with urination. They can feel incomplete voiding and constipation. And as pelvic floor physical therapists, we are trained to help release those muscles and to teach you self-care strategies, lifestyle modifications in order to help resolve these symptoms. A lot of clients with endo also struggle with musculoskeletal dysfunctions. Our bodies respond to pain by guarding and tightening. Therefore, clients with endometriosis also tend to grip certain muscles in their body because of that pain and can often develop musculoskeletal imbalances. They can either consciously or subconsciously grip and develop trigger points in muscles, such as muscles in the abdominal wall, in the inner thigh are common, and even muscles in the back can be a source of trigger points for clients. And these musculoskeletal imbalances can actually pull the pelvic bones out of alignment. As pelvic floor physical therapists, we are trained to find the root of that imbalance. We can help lengthen muscles that are tight. We can help strengthen muscles that are weak and really rebalance that structural support and the musculoskeletal and the soft tissue support as well. These are just a few of the ways that a trained pelvic floor physical therapist can be an integral part of the healing plan of care for clients with endo and really can be such a beneficial and therapeutic part of the healing process. Thank you so much for joining me and taking a few moments of your valuable time to learn with me today. If you are struggling with endo, make sure that you find a great pelvic floor physical therapist to help you. It can be game changing in your plan of care.